This episode of Transmission Interrupted was recorded May 18th, 2026. This is Transmission Interrupted, a podcast series from NETEC, the National Emerging Special Pathogens Training and Education Center. Welcome to Transmission Interrupted from NETEC.
Hello and welcome to Transmission Interrupted. My name is Jill Morgan. I'm a nurse here at Emory University Hospital in Atlanta, Georgia. For those of you not yet familiar with NETEC, our mission is to set the gold standard for special pathogen preparedness and response across health systems in the U.S. with the goals of driving best practices and closing knowledge gaps and developing innovative resources. NETEC works alongside and in cooperation with the CDC and is funded by ASPR, the Administration for Strategic Preparedness and Response. And speaking of strategic preparedness and response, we are going to talk today with Dr. Gaby Frank, who's an internist and a professor of medicine at Johns Hopkins. She is the director of the Special Pathogens Center at Johns Hopkins and has joined us before for conversations about Hanta. I don't think we could have a more timely conversation than this to sort of set the record straight a little bit. So welcome, Gaby. So happy to have you with us today.
Thank you for having me back. It's always great to spend some time with you, Jill.
Yeah, so let's start out. I just want to maybe set the stage a little bit because I know there are a lot of questions that people have about all these things, right? It's the question of what do some of these things mean, these terms, where do we get them from? What is isolation and what is quarantine? So I want to start with just like setting the stage there and understanding that these are the terms as we define them here in the United States, and that because this is these are public health terms, they may be defined differently in other countries. Other people may use different terms or maybe use these a little bit more interchangeably than we do. But here in the United States, and again, this is from our Health and Human Services Administration, isolation is really what we think of like if you had a person, maybe they've got some infectious disease in the hospital and they're in isolation. And that's a sick person with a contagious disease and we're isolating them to keep other people from getting sick. So we're keeping the sick person away from other people. When we think about quarantine, we're still separating them. And in most cases, when we say quarantine here in the US, we're talking about actually restricting the movement of people. They may not be sick though. These are people who were exposed to a contagious disease and we're watching them to see if, in fact, they become sick. Because for some contagious diseases, and I'm not saying this is true for Hanta, I'm not sure how much we know yet, but for some contagious diseases, they could spread that before they even get sick. So famously, of course, if you have somebody with measles, you can spread measles even before you develop symptoms. So it's really important that these kinds of measures can be put in place to help protect others who are just sort of innocent victims and might run into people or be in contact with folks. You certainly wouldn't want the people who are serving you food or working right next to your cubicle in the office or wherever you are to have something highly contagious. You would like to think that they could be separated if that were possible. So let's just start there and then let's dive into a little bit about this Hanta outbreak. I guess, Gaby, to me, this is certainly not what we were thinking of when you and I last talked about Hanta. Can you just give a little bit of an overview of the species of the Hantavirus that's in question here and a little bit of background about Hanta and how it makes people sick?
Absolutely. So for those who missed the last podcast, you should go and listen to it. It was a lot of fun. And there's a lot of great information shared on that one. So, and probably for those who listen to us, this is going to be repeated information, but there's many hantaviruses that are described in the world, over 28 or around 28 that are described to cause disease in humans. In the Americas, North, Central, and South America, we have a lot of different strains of hantavirus that cause what we call hantapulmonary syndrome or hantacardiopulmonary syndrome. And they are all throughout America. So we do have our own strains in the US, particularly in the area of Four Corners. In Argentina, that's where the ship started. I think that's what we're talking about in this virus. They also have many different hantaviruses. But this virus strain is particular for the area of Patagonia. And this is the one that is known to cause human-to-human transmission. There's two strains of Andes viruses, the typical Andes virus and the one that is called Buenos Aires virus. The International Committee on Viral Taxonomy still considers it as a separate Andes virus. But there's two only that have been identified that can cause human-to-human transmission, but they're both in the same big group of Andes viruses. And again, this is the one in Argentina, but this is not the only hantavirus that people have in Argentina. So even when we think about exposures with rodents in Argentina, it's not the whole country that is at risk for getting people exposed to Andes virus. It's just certain particular areas of Argentina. And what is important to know about Hanta, as we said before, particularly the viruses that cause Hantavirus syndrome, is that there's a lot of different strains throughout America, and most of them people acquire it from contact with mice droppings that may be infected with the virus. So I think that knowing the precautions on how to prevent getting hantaviruses is key, no matter where you live. So I think that now that we're getting to the summer times when people start cleaning garages and stuff, it's always good to make sure that area is ventilated, that if we're going to be generating some dust, that we'll wear masks and gloves, and just be careful because this is not about Andes virus, but, we do have our own hantas here that we should try to prevent.
Yeah, and I think it's a really important point. I'm glad you brought this up, that there are these viruses that can make people sick if you get it straight from the rodent droppings, saliva, whatever, that's been contaminating the area. But for most of those, they don't make anybody else sick, right? So in other words, you get it from this mouse, but unless somebody else was in contact with the mouse or the mouse stuff, we'll just call it stuff, they're not going to get sick. So there's very few of these hantaviruses that actually then have person-to-person spread, where if I get it, I can give it to you. So we have a bunch of hantaviruses. We have only a few that can make people sick person-to-person. But all of those hantaviruses can make that one person very sick. Like you said, Hantapulmonary syndrome. I don't, I think breathing is just an underappreciated skill. It's really important. Nothing can make you feel worse than not being able to breathe. And so Hantapulmonary syndrome is a very serious thing. And this is why we take these pathogens so seriously. But again, we have all the hantaviruses you can get from the rodents. But if you're not exposed to the rodents, the actual odds of you getting these from another person are very, very small. So, as a lesson, we want to say, look, you want to avoid getting them from the animal. You want to avoid getting them from the rodents. As it turns out, even that's not that easy, right? I mean, I think that was one of the great things, really, that was sort of revelatory to me talking with our hantavirus expert from the University of New Mexico. Dr. Bradfute said, actually, as it turns out, there's a lot of Hanta out there, and it's not making people sick. So I want to say we're going to try to fill in as many gaps in information as we can today, but there are still a lot of gaps out there. And I think, Gabby, when you and I were talking earlier, you were talking about some other gaps just from a clinical, like internist, your work, the things you wish you knew about this pathogen, like how prevalent is it? How many people might have been exposed and never have had symptoms? Where is the science on things like that?
I think that is one important thing to remember about science, right? We don't start knowing everything. So I think that what we know about different pathogens and science in general changes over time, because the more we know, the more the opinions may change because we have more information to actually make recommendations upon. So some of the things that we don't know is like, what are the chances that if you get exposed to the Hanta, either from mice or from another person that has, in this case, Andes virus, what are the chances that you're going to get sick? And that is something that we're still trying to understand. We talked in the last podcast how there were some seroprevalence studies in Europe for a different hantavirus that they noticed that some people actually tested positive even though they never actually had symptoms. This is something that we're still lacking and we need more information on. What we do know, though, is that a group of researchers in Chile, what they did is they followed people who were in contact with 76 confirmed cases of Andes virus, that is the hantavirus that we're talking about right now. And again, the 76 were not all at the same time. The study was done over many, many years. But they followed like over 470 contacts of those people. And only 3.3% of the contacts actually develop the disease. So do we know that it's always this rate? Do we know exactly what are the risks in each of these people that put them at higher risk for developing? What they did notice by following all of these contacts is that sexual intercourse was the highest risk for actually acquiring the disease. We do know that the close contacts are usually people who are in close areas with them, either household members or romantic partners. So I think that there's still a lot more to learn about it. But even from this study, when they were following contacts of people that had confirmed in this virus, 3.3% were the ones who actually developed the disease. There's still more to understand, right? We don't know how many of those who will get exposed to the virus through rodents will get the disease, as we still don't know how many of those who get exposed to someone that had in this virus, that is the one that can transmit from person to person, will actually develop the disease. So we need to be careful and treat everybody as a potential risk of developing the disease, just to make sure that we keep not just the exposed people safe, so we can identify the disease early and treat early, but also the rest of the community safe.
I think it's a great point that when we don't know enough, we'd like to think, and I hope this is a lesson, speaking as a healthcare worker, that we actually learned from COVID, which is we want to protect ourselves. We want to protect our coworkers. We want to protect the healthcare community, which we didn't necessarily do a great job of before. And so we're going to sort of maybe even overprotect to start with, because we can always back down a little bit. I know that, Dr. Frank, you've had the same experience where, gosh, you're taking care of a patient for a few days and then suddenly somebody decides to put them in isolation and you're like, oh my gosh, wait a minute. Like, I've already been in contact with them. And that's a terrible feeling, right, for anybody. We want to protect you before you have that contact. So I think you're right. There might be some things we don't know. We might be overshooting the protection, but we'd rather do that and be able to back off as we learn more than to say, oh, sorry, we didn't protect you and we should have. I think it's really important to go back to one of the things you mentioned about these are the kinds of things that maybe people don't think are so important when you're talking about, oh, I do research on, mice in cactus, or I do research on these things that are down in Patagonia. But we live in such a connected world. We want to go out and experience the world. We want people to travel. We want to travel ourselves. We want to be able to be out and about. And so the more we know about these pathogens, in some ways we find out some things that tell us, oh, well, you know what? It's not such a big risk. Maybe we've overshot the risk about some of these things. But if we don't know anything about the pathogen, then it's just a big black box of confusion and fear, and that's not good for anybody. I think that I would like to ask about, you mentioned like sexual contact, close romantic partners, being in confined spaces versus maybe what we think of as casual contact. And so from your perspective, when somebody says, well, you don't seem to be able to get it from casual contact, is that like me going to the grocery store or me being on public transportation, or where does casual contact end and close contact begin?
When we're in the US, we need to consider contacts per the CDC definition, and different countries will have different definitions. What is considered close contact? So everything that is not in the close contact is considered casual contact. Like when we're talking about human-to-human transmission, right? Not when we're talking about an environmental exposure, but when we're talking about human-to-human transmission, what they consider in Argentina is 30 minutes, less than 1 meter of distance, right? So that is like 30 minutes within 1 meter. That is actually pretty close. So I think that when we're talking about transportation, it depends on whether the transportation was a 2-hour transportation and you share the seat with the person versus you're like 6 rows back and there's enough ventilation in the area. So I think that the definition may vary a little because it's hard to, when we make definitions, to address every possible scenario. So I think that we need to always be rational when we address each particular case and see do they meet the definition or not. But the big definition for low risk contact, and this is for Argentina, and this is for their definitions, is that Argentina and Chile are the 2 countries that have an endemic area for this virus. So I'm using the definition from Argentina because I am originally from Argentina. So I'm very used to those definitions. Basically, low risk contact is half hour, less than 1 meter. So that seems like probably crossing path with someone in the grocery store doesn't even meet the no contact, the no risk definition. So it's not even considered a risk. And again, we live in the United States, so we need to, when we address this, we'll go by the CDC definitions. That's just how this varies, and we need to analyze each case in particular when we encounter this. And the other thing that I wanted to bring up, again, talking about Argentina, is that in the epidemiological bulletin for this last season for Hanta, although there were like around 100 cases of Hantavirus diagnosed in Argentina in the last season, the last Hanta season, only around 10 happened in endemic area for Andes virus. So although it's endemic area, you can see how people that live in area where the rodents are, or there's Hantavirus, they were only like around 10 cases. So I think that we still need a little more understanding and what are the true risks of actually developing the disease after exposure to an infected rodent or the infected rodent droppings.
I'm hoping that if people can take one thing away from this today, it's that yes, Hanta is out there in the United States, in Central and South America, but generally speaking, in a form that requires humans to be in contact with aerosolized, infected rodent urine droppings or saliva that we've stirred up, typically, as you said, like I'm cleaning up, I'm sweeping, I'm washing something out, I'm disturbing these things, and I might inhale or somehow contact with this infected rodent excrement. Only of all those places that are potential exposures, which I think for most of us is not, maybe you're camping, maybe you're cleaning out cabins, maybe that's your job, and that definitely means you need to use precautions. But of all those Hantas, there's only a little bit that's actually then possible to transmit one person to another. And even then, with that small number of things that can be transmitted person to person, we think you need pretty close or sustained contact, like you said, within arm's length and for about 30 minutes. Now, that could absolutely happen if you're stuck on a plane, train, automobile, in an office next to somebody, perhaps in a cubby. But you could also get the flu from them in those situations, or some of the other pathogens that we transmit all the time. So I think really it sounds like as serious as hantapulmonary or hantacardiopulmonary syndrome can be, and we're talking serious, like 30% fatality rate, right, for some of those things. So very serious diseases. They're still, luckily, amazingly difficult to get. And probably, while we want to take them very seriously, we don't want this to rise to the level of really freaking people out.
Absolutely. I think that we are at a point where we want to make sure that everybody's safe. We need to monitor the people that were exposed because, that we're sharing like in close space with confirmed cases. At the same time, at this point, there is no risk for the general public. So while we will still recommend to wear precautions, because there's people having, as you said, flu or other things, we still, want people to stay safe. But the risk for acquiring an infection from Andes hantavirus is for our general public. So I think that what we have right now is a great national, international collaboration where we actually learn from each other and we try to share information so we can, if something like this happens again, we're a lot better prepared to actually prevent cases and treat people as fast as possible. So we're always trying to learn and do better for our communities, but no risk for general population.
I think that's a great way to wrap this up. So yes, we want to support research. We want to support the people doing the research that keeps us safe. And that means we have to look at some of these pathogens. We need to know things like how easy are they to get and where do you get them from? And there are always going to be some questions we don't have answers to. But as Dr. Frank said, the risk for this one, for the general public, is very low. We're hoping for the good health of anybody who is exposed, because if they get sick, it can be quite a serious disease. But that doesn't mean that the rest of us who haven't been exposed have something big to worry about. So, Gaby, it's such a pleasure to talk to you. I really enjoy spending time with you. I love to hear more about your history with treating these things and thinking about these things from the perspective of somebody who actually lived in places where they are much more common. So thank you for joining us again today on Transmission Interrupted.
Thank you very much for having me. Jill, always a pleasure. You're the most engaging host that I've worked with. You're amazing.
Well, thank you. It's because we always pick these interesting topics. For those of you listening at home, thank you for tuning in to this episode on Andes Hanta. We hope you'll join us for future episodes on whichever pathogen might show up next, but also about healthcare worker safety and personal protective equipment and any kind of infectious disease. If you have questions for NETEC or ideas for future shows, please feel free to contact us at info@netec.org. That's info@netec.org. You can also find us on the web at netec.org/podcast, where, of course, you can also subscribe to future episodes. So thank you so much, and we will see you next time on Transmission Interrupted.
You've been listening to Transmission Interrupted, a NETEC podcast, produced and edited by Benjamin Madsen, with additional support provided by Britton Clark, Veronica Lavaro, Jason Noble, and Lisa Stone. Special thanks to our guests and the subject matter experts at NETEC for their insight and guidance. This podcast is supported by the Administration for Strategic Preparedness and Response. For more information, tools, and training on special pathogen preparedness, visit netec.org. And don't forget to subscribe, rate, and share the show on Apple Podcasts, Spotify, or wherever you get your podcasts. Thank you for tuning in to Transmission Interrupted.